My name's Randy Farrow. I'm the Chief Executive Officer of the Mankato Clinic. The Mankato Clinic is a multi-specialty group. We have about 90 physicians and roughly 60 advanced practice providers serving South Central Minnesota. Several years ago, we were looking at strategies to improve our financial performance, and we became acquainted with MediSync and their CodeRight program. We realized as money continues to get tighter and tighter in healthcare that we couldn't afford to leave money on the table due to inadequate documentation and coding. The powerful thing about the MediSync CodeRight program is it's delivered by physicians. So the trainers are physicians. They understand the challenges that physicians have and the pressures that are on them in their day-to-day work. And so they can speak their language. And really what they've been able to do for us is teach our physicians how to put down on paper what is in their head, and that leads to a better coding outcome and a higher level. So the CodeRight training is customized to each provider. It takes into consideration their unique workflow patterns and habits. They really customize and tailor the training to be specific to that provider. What we saw was that they come in and they have an excellent three-stage program where the first step is just to teach the providers what goes into documenting effectively for the visit. They look at actual notes from that physician to see where maybe there's gaps in their documentation. They come back and review those charts again after training the physicians to see if the improvement is occurring. And then there's a final third session where they sit down and look at that one more time to make sure that the training has really taken hold. Our return on investment from the MediSync CodeRight program has been substantial. What we've seen is a significant increase in our revenues and also a decreased risk of coding audits. I would say that in the first year after we implemented the training for our physicians, we saw about a $500,000 improvement in annual revenue. And the nice thing about that is it's like an annuity. It continues to recur year after year. And as we add new providers, that ROI just continues to grow on the program.